If you're in your 60s or a senior citizen about to enter into your 60s, this is a perfect time to reflect on where you are with your health and what you want it to look like in the years ahead. As a doctor who has worked in a variety of settings from urgent care to family practice internal medicine, I've seen many seniors, and I'm going to be sharing some very important health topics that you should have checked off if you haven't already. So let's talk about them now. No. One is getting your shingles vaccine. Shingles is a viral infection that comes in adults and children. Children usually get the chickenpox virus, and then that stays latent in the body until adulthood, typically when we're more susceptible to stress and our immune system is compromised, which happens with age. That can trigger the virus to come out. It comes out in one nerve distribution on one side of the body, causing severe pain, burning pain, tingling, and you get blisters that eventually scab over. It can happen anywhere on the body, but most commonly, it happens on the chest wall and abdomen area. The problem with shingles is that it can lead to postherpetic neuralgia, which means that even after the blisters heal, the pain continues because that virus has affected the actual nerve fibers themselves. And so it can cause chronic pain, chronic nerve pain. There's no cure for it once you get it. The only prevention is getting the shingles vaccine. Shingles vaccine is 2 doses. If you've had shingles before, then you need 2 doses separated by 28 days. But if you've never had shingles, you just need 1 dose of the shingles vaccine, which we call Zostavax or Shingrix. Now, shingles can occur at any point in life, but the risk increases significantly when you become 50 years of age or older. So now is the time. If you're watching this video and you're under 50, please share this information with your friends and family members who are over 50. This is very important. Number 2 is getting your pneumonia vaccine, also called the pneumococcal vaccine. Pneumonia is a serious lung infection that can be caused by bacteria or viruses. But for this particular vaccine, it's for the bacteria that causes pneumonia and meningitis. Now, there's 2 types of pneumonia vaccines. There's the 23-valent polysaccharide vaccine. It's the one that's been around for a while. It's not very expensive. It's about $100 if you don't have insurance. And it covers the 23 most common types of Streptococcus pneumonia bacteria that cause pneumonia and meningitis. Then there's the newer vaccine called Prevnar 13. It covers 13 different types of Streptococcus pneumonia bacteria. You need to get both of these vaccines if you haven't gotten them already. When you go to the doctor's office to get the vaccines, they'll probably ask you how old you are. Based on your age, they will decide which vaccine to give you first. If you're over 65, they'll give you the new one, Prevnar 13 first. But if you're younger than that and you haven't gotten either vaccine, they'll start you on the 23-valent first, then give you the new one. Now, the reason why we recommend getting both vaccines is that the 23-valent polysaccharide vaccine doesn't work very well in people under 65. And the new vaccine doesn't cover all the types of pneumonia that the 23-valent vaccine covers. So you need both. Now, the nice thing is that you don't have to get those 2 vaccines on the same day. You could get them months apart. You don't have to do it at the same time. So make sure to check with your doctor to see what your schedule looks like to get those vaccines. No. 3 is getting a colonoscopy. Colonoscopy is a procedure to look inside the colon and rectum. We use a scope with a camera on the end of it that goes through the anus and into the rectum and colon. And we look for any abnormalities, especially polyps. Polyps are little growths in the colon that can develop into colon cancer if left untreated. And colon cancer is one of the leading causes of death in the U.S. So we want to prevent that by finding those polyps early and removing them during the colonoscopy. Also, if there's any signs of inflammation or bleeding or ulcers or anything else abnormal, we can find it during the colonoscopy. Now, the recommendation for a colonoscopy is that you do it once at age 50, and then after that, it depends on your risk factors. If you have no risk factors, then you can wait until you're 75. But if you have risk factors, you might need to have them more frequently. Risk factors include having a family history of colon cancer or polyps or inflammatory bowel disease like Crohn's disease or ulcerative colitis. Those are risk factors that would put you at a higher risk of getting colon cancer. And therefore, your doctor might recommend doing the colonoscopy sooner rather than later. For some people, they might even recommend doing the colonoscopy before the age of 50. Another risk factor is having a personal history of colorectal cancer or polyps. So if you've had that before, then you need to talk to your doctor about how frequently you need to get the colonoscopies. How often you get a colonoscopy after your first one really depends on what was found during that first colonoscopy. If nothing was found, then you can wait longer in between the procedures. If something was found, then you might need to get it done sooner. Also, if you have symptoms, you need to get it done sooner. Symptoms would be blood in the stool, changes in your bowel habits, weight loss for no apparent reason, abdominal pain, cramping, bloating. Any of those symptoms might require that you get a colonoscopy earlier. So talk to your doctor about the risks and benefits of a colonoscopy and when to get it done. Number 4 is getting your bone density checked. Bone density is an important measurement of how strong your bones are. Bones become weaker with age, especially after menopause in women due to decreased estrogen levels. But men also get weaker bones as they age, so it's important to get your bone density checked if you haven't already. Now, there's certain conditions that make it more important to get your bone density checked, including having a family history of osteoporosis or osteopenia. Osteopenia is when your bone density is lower than normal, but not low enough to be considered osteoporosis. Osteoporosis is when the bones become so weak that they're more likely to fracture. So if you have a family history of osteoporosis or osteopenia, you should get your bone density checked. Also, if you have certain medical conditions such as rheumatoid arthritis or hyperthyroidism, those can put you at risk for weaker bones. Also, if you're taking certain medications, those can put you at risk for weaker bones. And those medications include proton pump inhibitors, which are medications like Nexium or Prevacid, medications for seizures, anti-seizure medications, and also diuretics, medications for high blood pressure. So if you're taking any of those medications, you should get your bone density checked. And of course, if you've already had a fracture, you should get your bone density checked. You don't need to do anything special to prepare for a bone density test. Just show up at the doctor's office and they'll take the test for you. It's a quick test. It's painless. You don't have to do anything special. You don't have to be fasting. You don't have to be undressed. You just show up and get it done. All right, no. 5 is getting your eyes checked. Getting your eyes checked is important for everyone, but especially for seniors. Eyes are very important because they allow us to see the world around us. They allow us to drive safely. They allow us to read and write and do all the things that we need to do on a daily basis. As we age, our eyes change. Our vision changes. We develop farsightedness. We develop nearsightedness. Sometimes we develop cataracts or glaucoma or macular degeneration. All of those are problems that affect our vision, and they can be prevented or treated if caught early. So make sure to get your eyes checked regularly. You don't have to do anything special to prepare for an eye exam. Just show up, and the doctor will check your eyes for you. Now, if you wear glasses or contact lenses, make sure to bring those with you to the eye exam so the doctor can evaluate your prescription and make sure it is still valid. All right, there you have it. These are 5 very important health topics to discuss with your doctor. If you in your 60s or entering your 60s, please comment below and let me know which of these you thought was the most important and why. If you enjoyed this video, please give it a thumbs up and subscribe to the channel. And I'll see you next time. Bye-bye.